According to the American Cancer Society, each year in the United States alone, about 210,000 people are diagnosed with the disease of cancer. While there is no cure for cancer at the moment, new treatments and therapies are being developed that can extend a patient's life by a few months or even years. The American Brain Foundation reports that 1 in every 68 people in the U.S. will develop some type of brain diseases such as Alzheimer's or Parkinson's. This puts everyone at risk of developing an intellectual disability due to such diseases. The good news is that you don't have to stay sick if you're diagnosed with cancer. In this blog post, we will discuss what happens in your brain when you get diagnosed with cancer and how it might affect you emotionally and cognitively. Cancer is the abnormal growth of cells in the body. When a person is diagnosed with cancer, the cells inside their body that make up the organs, tissue, and cells begin to grow out of control. Oftentimes, cancer patients experience intense fears and worries about their health in the future. This can lead to a condition called obsessive-compulsive disorder. Patients with OCD have repetitive and constant thoughts and fears about the future and their health. These patients may obsess about upcoming surgeries, chemotherapy drugs, and other cancer treatments, and general health concerns. OCD is treated by exposure therapy, medication, and relaxation techniques. Exposure therapy is when a patient is slowly and methodically introduced to the things they are afraid of. This is done in a safe and controlled environment so that patients do not feel overwhelmed by their fears. If you know someone who has OCD, you can help by not taking their thoughts seriously and reassuring them that everything will be okay. If you are interested in learning more, there are support groups online where patients with OCD can talk and share their experiences with one another. Alzheimer's disease is the most common form of dementia, which is a degenerative disease that causes your brain to slowly deteriorate. Alzheimer's disease destroys your brain cells and shrinks your brain size. This can result in a person forgetting things that they once knew, such as their own name or even who they are. Dementia is a broad term for diseases of the brain that cause problems with memory, thinking, and/or behavior. One of the main factors that increases the risk of contracting these diseases is age. However, more and more younger people are being diagnosed with these diseases. Dementia and Alzheimer's disease can be devastating to patients and their loved ones. In order to lower your risk of contracting any of the above-mentioned diseases, make sure to eat healthily, exercise, and keep your mind active by doing puzzles, reading, or solving complex math problems. If you are diagnosed with cancer, you may be worried that the treatment will worsen your condition. Luckily, newer types of cancer treatment drugs have fewer side effects and are less toxic than the previous ones. These new drugs are less harmful to your body and are less likely to damage your organs and tissues. However, these drugs can still have negative effects on your cognitive functioning. Some of the most common cognitive side effects of cancer treatment drugs include slower reaction times. Slower reaction times can lead to accidents and injury. Slower processing speed. It takes longer for you to process information and respond appropriately. Difficulty in multitasking. It is difficult to focus on several tasks at once. Cancer is a disease that affects millions of people around the world every year. While there is no cure for cancer, new drugs and therapies are being developed to help patients manage their condition and live longer, healthier lives. When a person is diagnosed with cancer, their whole day-to-day life is disrupted. Patients have to endure a lot of stress, fear, and anxiety because of the destructive nature of the disease. There are many ways you can reduce stress and anxiety when you are diagnosed with cancer. Taking care of your mental health is just as important as taking care of your physical health.